something?
In this video, we will demonstrate how to dissect the left ventricle and remove the papillary muscles.
Sorry.
What you see now is a rat heart. Using a pair of forceps and a pair of scissors, the technician first trims away the atria, valves, and blood vessels that lie above the ventricles.
Would you mind just showing the base? What you're
Once the
looking at
atria have been trimmed
there.
away, the openings of the right and left ventricles can be seen at the base of the heart.
There you go. That's great. Thank you.
The right ventricle can be identified by its thin wall. Its opening at the base is crescent-shaped. The opening of the left ventricle is circular and surrounded by thick muscular walls. The technician now holds the thin wall of the right ventricle and trims it away from the septum. Once the right ventricular wall has been trimmed away, a cut is made down the center of the septum, from the base to the apex. The technician now pins down the walls with the epicardium down to then expose the endocardium. Relative to the technician, the heart is now upside down and the apex away from the technician. The anterior and posterior papillary muscles are now visible. The anterior papillary muscle is to the left of the technician, and the posterior papillary muscle is to the right. The technician now cuts out the papillary muscles. This is usually done with a finer pair of scissors. It is very important not to hold the muscles with the forceps. Pinching or pulling the muscle will damage it and render it useless for later physiological analysis. Once the papillary muscles have been removed, they are then taken away for clipping.